Welcome to this webinar on stepping up the prevention of violence against healthcare workers. This is a joint webinar produced by Emma and the EUPHA Health Workforce Research Group. And we have lots of great people, great speakers that I'll introduce you to in a moment who've contributed to putting together this very important webinar. What I want to say to you to start with is that this webinar is a call for unity and mobilisation and to explore opportunities to better address the presence of increasing violence against healthcare workers. We thank you, the audience, for attending and supporting this important topic, and we really want to hear from you today. So do make use of the Q&A and the chance to chat with us today. We've built in lots of time to have a discussion with you. We know that there's an overwhelming amount of anecdotes, but a deficit. So we are not here to just talk academically. Instead, we want to frame this as a policy issue and to join forces in ways to address this collectively. So the agenda for today is to have this lineup of speakers. We've got Dr. Kuhlmann, Dr. Tomas Zapata, Dr. Michelle Falkenbach, Ms. Sarada Das, Dr. Katarzyna Czabanowska, Professor Jose Martin Moreno, and myself, Mr. George Valiotis. So we're going to go through a quick 5 minutes each to give you the insights from our different perspectives. And then at the end, you'll see we've got 20 minutes of discussion with everybody. So, so that's us to set up the agenda. To show you those speakers I just described to you, this is who they are, and you'll also see them, but they have their videos active. And now you'll get to meet them one by one, and I'm going to start by handing over directly to Dr. Kuhlmann, who's from the EUPHA Health Workforce Research Section and the European Public Health Association. Ellen, thanks for joining us, and thanks for your great leadership on this work.
Thank you very much to George, Emma, and all the colleagues who are willing to participate in this webinar and give me the opportunity to talk to you. My main point today is to highlight that violence against healthcare workers is indeed a public health problem, and it needs a comprehensive policy perspective. Why is prevention of violence so important? There are many reasons. First, it has really dramatically increased during the COVID-19 pandemic. It has led to more stress, more health risk. It has increased the gender-based violence. It has increased racialized forms of violence. And the violence has spilled over to the private sector, to the social media, to many other areas. And it is not only an individual issue, that it is definitely also because it affects the individual healthcare workers, but it is much more. It also affects the healthcare system, the provision of healthcare, and finally, it puts new threats and risk to the sustainability of the health workforce, which is already, as we all know, very fragile. So violence against healthcare workers must be seen as a public health crisis, and we should try to find policy solutions. It affects all sorts of healthcare workers, although sometimes in different ways. It affects, at first and foremost, the frontline healthcare workers and those working in more politicized services. As you all know, these were especially the vaccination provision services, but also very often abortion services. So it affects mainly women and nurses, because these are the majority of healthcare workers. And as in most healthcare systems, we also have a relevant proportion of migrant healthcare workers. It affects them also. And currently, very, very little is known on how that actually turns out. So what can we do? A few major policy recommendations from our side. So the key issue is really to join forces to connect all stakeholders from different groups and different sectors, and to make sure that governance action has been taken on the different levels. So on the micro level, we should prepare healthcare workers. We should give them better opportunity to cope with this situation. Improve mental health support, but also improve education and training. On the more organizational and management level, and I keep that brief, as I know we will hear much more on that, but there is really a lot to do to define prevention as management tasks, to take action to implement zero tolerance, establish guidelines, establish helplines, and support mental health. So these are only some examples. It is also on the policy level very important to improve the monitoring systems. Currently, we don't have sufficient data. To engage the public, very, very important on many different levels. Also to collaborate with police, to collaborate with civil society, and to improve leadership of international public health organizations. Take action against violence against healthcare workers on all levels and considering all forms of violence. And that means 3 major conclusions. Make the prevention of violence a health policy priority, connected very closely to trans-sectoral multi-professional governance action, and connected very closely to the health workforce policy, discussing retention issues and mental health policy issues. So this is basically my main message for today, and I'm referring to a paper that we have published with many colleagues who are also part of these webinars, or many of them are part of that webinars. And maybe Emma, colleagues, you could put that link in the chat. Thank you very much.
Thanks, Ellen. We will put that link in the chat. So just to the participants, I'll remind you, you can ask a question at any point in the Q&A box down the bottom. And we're just doing this webinar is just a quick overview, really. We brought a lot of people together. So it's lots of quick, short presentations, but it's for us to get the conversation started. In that sense, I'll now hand you over to the next speaker, which will be Dr. Tomas Zapata from WHO, who has a responsibility for workforce and mental health. Thomas, thanks for joining us.
Thank you so much, John, for this opportunity. It's a pleasure to be with all of you here. So, as we see in the WHO European region, health workers, as in other regions of the world, they are at high risk of violence and attacks, and it's both verbal and physical. And during the COVID pandemic, the COVID pandemic has put our systems under unprecedented pressure in ways that have raised anxiety and frustration for both patients and health workers. Consequently, COVID pandemic has worsened violence against health workers with a documented increase of incidents in many countries. And I think you can see more figures in the paper that Helen was talking about. And as Helen mentioned, the violence has a huge impact, a psychological, physical impact, in terms of job motivation, but also in terms of compromising quality of care of services, and also in terms of financial loss for the system. I think it's important to keep this in mind. And we have seen that mainly frontline health workers are mainly affected, but we also need to bring many other types of health workers working in nursing homes and in other areas. So I think we need to look at to have a comprehensive view of all health workers and bring the gender aspect, because as we know, the big majority of the health workers in our region are women. So we need to bring this component also, importantly. And the time to act, you know that recently last year in September, during the regional committee, we launched the report, the WHO report on health and care workforce in Europe, Time to Act. And we were talking about time to act, and for violence against health workers, it's clearly time to act because of this increase that we are having. So it's time to really take measures in terms of improving the conditions of health workers and taking measures in order to stop this. So what is WHO doing? First of all, I would like to introduce the Care Compact that WHO worked in May 2021 during the World Health Assembly. It was adopted a resolution requesting WHO technical guidance to member states on how to protect health and care workers and safeguard their rights. So the WHO Care Compact was therefore developed and provide recommendations on how to protect health and care workers and safeguard their rights, and to promote and ensure decent work free from racial and other forms of discrimination, and a safe and enabling practice environment. And the compact, the Care Compact, sets out complementary management and policy actions structured around 4 main domains, namely preventing harm, providing support, inclusivity, and safeguarding rights. And it's based on a range of existing international conventions, instruments, and treaties and resolutions. So that's the first thing that WHO has done, which is the Care Compact. But it's not just enough this focus on government action. We believe that it's also important a whole of society approach, and I think Ellen was referring to this before, including private, non-governmental, faith-based employers of healthcare workers, and the international community and the public to respect the health and care workers' rights. And for this, WHO will keep positioning violence against health and care workers as a central element. You know that in 10 days, we are organizing the regional meeting on health and care workforce in Bucharest, and we are going to be launching a Bucharest declaration, really to position health workforce at the central stage. And the declaration contains a paragraph on violence against health workers. So I think WHO can play this active role in really positioning and raising the voice on this. Second, we will have a resolution in October in the regional committee, and the framework for actions, in one of the actions will contain actions to stop violence against health workers. So that's going to be really high for us as well. And in all the country support the WHO is providing, this is a key message as well, that when developing national strategies on health workforce, we also want to bring a component on how to stop and how to prioritize stopping violence against health workers. And only all the media communications that WHO is putting in place, we also want to place this as a central place. And I would like to say that our regional director, Dr. Hans Kluge, is very clear on this. This is a red line, and there is a clear commitment to really put all the efforts to stop violence against health workers. Thank you so much.
Thank you very much, Dr. Zapata, for giving us those great insights into the good leadership that WHO is doing. And it's great to know that it's high on the agenda and how much work is addressing this. So many thanks for being here today. Next on the agenda, I'm going to hand you to Dr. Michelle Falkenbach. She's from the European Observatory on Health Systems and Policies. Over to you.
Thank you so much, George. And thank you to Emma and EUPHA for having us here today. As George mentioned, I'm from the European Observatory on Health Systems and Policies, and we are very much interested in pushing forth the research on this topic because it's an immense issue, and it would be exceptionally beneficial if it was elevated to the policy level. And what Tomas had just said is music to our ears, because we're very happy that this issue is getting the attention by the WHO. The reasons why this is such a big issue, I think, were covered very nicely by Ellen, so I won't go into that. But I will talk a little bit about a forthcoming commentary that we have collaborated on with Ellen Kuhlmann and colleagues from Brazil and New Zealand. And in this commentary, we argue that policymakers, health policy in general, needs to be held accountable and improve the protection of health and care workers. And we do this by looking at 4 countries. So we look at Germany, the United Kingdom, Brazil, and New Zealand. And we find that poor data and monitoring hampers effective violence prevention, because data is scattered and access is generally limited in all of these countries, aside from perhaps the United Kingdom, which is a little bit more advanced than the rest. But there's really not enough data collected on this issue. Furthermore, there's no clear health system pattern that can be identified in our research. And at the same time, we find that professional associations and partly the media are strong policy actors against violence, and they really highlight the importance of civil society as areas that are propelling and drawing attention to this issue. The next point that we find is a lack of attention to gender-based, sexualized, and racialized dimensions of violence that threaten women, specifically in the nursing profession, and also migrant and minority groups the most. So these are the most vulnerable people that we also heard from what Tomas has said and Ellen as well. And the final thing is the strong political leadership and effective policies would play a critical role to aiding health and care workers. So what needs to be done? And in our article, we have two concrete things. First, we need to get support and protection right in order to enhance the retention of the existing workforce and attract new generations of health and care workers. We see everywhere across the region that we're lacking medical workers, healthcare workers, and we need to get new people into the profession. We need to be able to retain the existing workforce as well. And the second thing is we need to improve the working conditions, and that includes mental health and physical safety of health and care workers. And this is something that we find is not only an obligation of employers, but it's also in the hands of governments and politics. And we see that the WHO is really doing its part on this and really promoting this. We need to make sure that that trickles down to each of the national governments as well, and that much more emphasis is put on this great issue. So in order to accomplish this, governments will be required to take action against violence and tackle the many individual risk factors the health and care workers face on a daily basis. And with that, I'll turn it back over to George. Thank you so much. George, you're muted.
Thanks for letting me know. I'm juggling too many screens. Thank you, Dr. Falkenbach, for those insights about what else is needed and what's known so far. I want to now hand you immediately over to Sarada Das, who's from the Standing Committee of European Doctors.
Thank you very much, George, and thank you very much for giving CPME an opportunity to share a few thoughts on this important event. Maybe just to introduce our organization. So CPME stands for the Standing Committee of European Doctors, and we represent national medical associations across Europe to provide the medical profession's point of view to European policymaking. And as you can imagine, the discussion on the situation of the workforce has really been increasing in urgency also within our membership, and such awareness days really mark one of the darkest sides of professional practice. And this issue, really, we already saw some other speakers have mentioned it in a broader context of the workforce, and we see that this is something which has actually an underlying fragility of the workforce in the health system and for the workforce. So we have been working on this for a long time, long before the pandemic, in particular in cooperation with our sister associations. For example, the Conference of European Medical Orders, which is leading the work on medical organizations in this area. And we already marked the 4th Awareness Day on this issue since our work really predates the pandemic even. But this year we're really giving it special attention because so many of our members are reporting increases of violence against doctors. And in some cases, there is sufficient data also to directly attribute how much of this has been attributable to the pandemic. So some of our members had police protection during the vaccine rollouts, but also there were increases, for example, in disputes around adherence to infection control measures. And when you look at the numbers of doctors who report not to really feel safe at the workplace, it's shockingly high. So some of the conclusions that we can draw from the observations that we've made over the past years also is that health professionals have a right to effective protection. And this starts with putting in place and raising awareness for reporting systems and systematic data collection mechanisms. And we see the value of this in countries such as France, where they can now already look back at longitudinal data back to the early 2000s. And here there is, of course, a role to play for national medical associations organizations to educate professionals on how to respond to situations in which they experience violence, but also what support is available. And in all countries, there is a very strong impression that incidences remain very underreported. And as was already mentioned today, the dimension of incidences among specifically vulnerable groups and health professionals also requires further attention. We also see that in all countries, there are, of course, laws protecting doctors from violence, but there are sometimes gaps to specific violence, which is identified as violence against doctors or health professionals. So, for example, there may be gaps in relation to verbal abuse or online abuse, which is becoming increasingly common, or also incidences of violence which occur outside of specific kind of scheduled appointments or healthcare facilities. So there is room here also in some cases to improve the coverage of laws and the protection that they actually offer. But the main point often is that the laws really have to be enforced effectively. And this is a task where there is a lot of coordination required between health professionals, but also law enforcement and judicial authorities. And in addition, there is also a dimension of public information which can be pursued. And the countries which have been most successful of this have really seen that you need a coherent violence prevention program that links all of these different actors together and also makes sure that there is a kind of coherent policy beyond political cycles. So at CPME, we will continue to highlight what evidence is available and encourage the collection of new evidence and also keep this issue high on the agenda. As was already said, we see this in the broader picture of the workforce, which is the lifeblood of health systems. And we fear that medicine is losing its attractiveness as a lifelong professional calling. So important measures such as this of preventing violence are really key to ensuring that there is effective and long-lasting action to ensure that the workforce has safe and lawful working conditions as it deserves and can continue to deliver patient care. I will leave it at that, I think, and thank you very much for giving us this opportunity.
Thanks very much, Sarada, for that great insight about the important work being done at CPME and what else we can be looking to address. And so now our final speaker will be Professor Martin Moreno. And I've just lost my notes. I've got too many screens active, but Professor Martin Moreno, you'll have to then tell us about your professional associations because they are many.
Thank you so much, George. And thank you, Ellen, and all our dear colleagues for letting me participate and raise my voice against violence, both on a personal level as professor of my University of Valencia in Spain and honorary fellow of the Faculty of Public Health in the UK. But on behalf, particularly of the public health education world, particularly the schools and public health training programs, which are integrated in ASFER, which is the Association of Schools of Public Health in the European region. And I have to start by stating what should be obvious. Violence is unacceptable. And of course, violence directed at health professionals, it is felt by all of us to be particularly serious and must be tackled. We must respond to the challenge with unity, synergy, advocacy, assertiveness, and respect. So I'm very, very glad to have participated under the leadership of Ellen with this excellent team doing our best in this endeavor. As for my role in this session, I have been asked to answer to the question, how can public health education contribute to tackle this problem? And I will need to say that as the problem of violence against health workers is real, and education should be aimed at preparing us to deal with real problems, it is obvious that we need to try to provide knowledge and skills to handle these issues in the best possible way. In this case, through adequate preventive prevention, early detection of the problem, synergy in the team, control, procedure for action, and proper advocacy. In fact, we need to call for mobilization, unity, and proactivity of generating ideas to solve this big problem. And we'll try to foster discussion, taking advantage of the aforementioned EUPHA and EMA meetings that were described by Ellen and by George, as well as any opportunity we have, including the 17th World Congress on Public Health that will take place during the first week of May in Rome, or at the ASFER Deans and Directors Retreat, which will take place in Dublin. The last day focus on the first days, early September. So, and having said that, I would like to say much more, obviously, but time is of the essence, and not before making it explicit my willingness to do all I can to contribute to this novel endeavor. Thank you so much.
Thank you very much, Professor Martin Moreno, for really helping us understand how can public health education contribute. And we're right on time. I'm going to now talk to you a bit about what health management can contribute. And as I do that, I'd also just encourage you to use the Q&A box. I can see that already one comment's been made, so that's there for everybody to see. And if you're in the audience now and you're feeling like you want to make a comment or ask a question, please take a moment to do that now in the Q&A. From a management perspective, there's actually quite a few things that have already been covered. And so what I want to add to what's been said already is, I don't want to repeat because we only have 5 minutes, but I will say this: there's clearly things that have been named that have already, that relate to management, like retaining the workforce, improving working conditions, and looking at the role of employers and at governments. At Emma, what we recognize is that the safety and well-being of the health workforce is of crucial importance, and that it's a concerning personal issue. It also is clearly a public health issue and a management issue. So I'm going to now speak to the element of it that is management. And from management, we've already heard from Michelle, that we from Professor Falkenbach, that Dr. Falkenbach, that we need more evidence on the practices so we can put the right practices into place. Now, we already can immediately, if you think of any employer, they have a responsibility to respond to challenges happening as they happen. So that's the personal response that you should be doing to make sure that your workers are safe today, that responses are being done effectively to any unsafety immediately. Then as we look at more effective management styles and for the immediate, for things happening right now, as well as looking at management practices that can help us in the longer term, referring to preventing ongoing instances of violence. That's where we need really the evidence base to help us even further to make better, more effective management decisions. And we recognize there's a lot more that needs to be done there. This webinar is one thing that we're doing to help improve the thinking and the management practice. The other thing is at the EMMA conference in June in Rome, we'll have a workshop that builds on this very workshop, on this very webinar here. We want to extend this conversation and keep it going. Now, there are some clear policies at organizational levels that should be happening. So practical things that managers could be doing include trainings, and that training could be on how to manage and cope with violence when it does happen. So upskilling professionals to be able to have the skills to manage things when they happen. Looking at additional security measures, look at workplace violence prevention interventions. So some of them would be adding security officers and other practices we'd like to hear about. If you have any ideas of that, please do put them into the Q&A or into the comments, or come to the workshop that we'll do in June and help us think these through more effectively. We want to encourage professionals to report violence, and therefore we also need to develop systems that captures this information so that we can have some more accurate knowledge about what's actually happening, and that this is properly understood and well documented, not just for responding as it happens, but for helping build better management practices. Now, a few other steps for management is thinking of health management. It actually has a very broad scope. So who is a health manager? Sometimes they're a very obvious job, like a CEO of a hospital, or they might be a manager of a primary care unit or of an aged care facility. But they are also policymakers, finance people. Health management includes lots of different job definitions. Now, Emma has done a definition of what health management is and what kind of jobs that has, which is published on our website. But I'd say the reason I suggest that is, in the one hand, you want to look at what are the challenges and the issues that we have to address. So that's been well described in this webinar. Next is, who are the different leadership roles, some of which I've just mentioned, that have a responsibility or an agency here. And then finally, we need to triangulate that so that the right people are taking the right actions at the right time. And to that end, I would say policymakers are also health managers. So whether it be a Ministry of Health or whether it be legislators in other ways, all of them have a role under the broad umbrella of health management. And the reason I describe that in that way is to make sure that all the right people are involved in the right ways at the right time. Finally, I'll say we want to explore prevention strategies that could be put in place. So that includes governance, operations management, personnel management. It also includes financial management, because if you're thinking about your duty to protect your professions and your workforce, failing to do that could result in liability. So we want to make sure that we're managing that, and that financial leadership is also considered in this. And then finally, I would say we've got another opportunity here to look at what are the skills that managers need in order to respond more effectively. And we want to make sure that we're investing in the skill development of managers so they have the tools, the knowledge and the abilities to put in practice all of these things that we want to ask of them. Let's remember they have to build these skills newly, just like we are coming together to better define what the topic is here. So that's it for me in a nutshell. As all the speakers have done, have very quickly described from our perspectives what needs to be done. So that's it from health management. That brings us right on time into Q&A. I can see already, Dr. Kuhlmann, thank you so much for answering the question that was put in the Q&A. And I turn to the audience to say, we're now here for you and we'd love to hear what other thoughts you have. While I wait for those to come in, I'll also turn back to the panelists to say, do you have any questions or additional reflections to share at this point now that we've all heard each other? Ellen, please.
Just a very brief comment, because I'm really so pleased and so thankful, because what is happening now with our very first initiative is really more than I could dream of. And that's exactly why we are doing this. I mean, it's so great what Tomas Zapata from WHO said, that they really bring that at the very high level. And I don't repeat everything, but I think, and we have CPME with Sharada, who brings it to the professional level, and we have Emma who brings to the management level, and then public health, and yeah, and in the observatory. And that I think that is the way we should really go forward. Of course, we need research, we need money, we need data, we always need that, but we rarely get it, at least not as quick and as much as we need. But we see now, if we join forces, we can make things happen, at least at the start. So to raise this awareness, which I really just want to say thank you. That's really great.
Thanks, Ellen. So I can see there's no Q&A coming up from the audience as yet. You did give us a lot of comments in your registrations, and those were really helpful starting points. I can reflect back to some of those, but I'd also just turn to the other panelists. Did anybody else want to add any other comments at this point?
I just want to emphasize what already had been said. We need to mobilize, all the possible synergy, and everybody participating in this webinar can help. So I'm sure that together we'll be able, if not to solve completely in the short term, but at least to tackle this in a rigorous way, because it is worthy the joint effort in order to tackle this problem.
Absolutely. And actually on that point, there is a question that's just come up from Zachary Dessen. And actually, so this could be one for Sarada, but really for all of us. And so the question is, healthcare workers in different settings, first responders, long-term care, hospitals, etc., all face different types of violence and require very different tools to manage it. How can we ensure that we hear from and implement the voices of all health workers in a way that meets their unique needs? Does anybody from the panel want to add to that?
Maybe I can just briefly respond to say that indeed we see even in countries that have relatively good systems that there is, for example, quite a divide between support to doctors working on their own in rural areas, so single practice doctors or hospitals. Many hospitals, they have security protocols in place, they have security personnel which is on site, so it is easier, that more doctors working there are more aware of what to do. So indeed, it is very important to make sure that these reporting mechanisms are easily accessible and that they do not require also time that doctors may not have to deal with the procedures which are lengthy or which require coordination by the doctor themselves. And this is something definitely which must be taken into account.
Thank you. Yes, Dr. Falkenbach.
Yeah, I also just wanted to highlight that it's a great question, because it really underscores the fact that everybody has unique needs and that we need to communicate those. We need to be able to address those. And that's one of the biggest challenges, because it's not a standard cookie cutter solution. It's a very individualized solution often. And one of the things that I also wanted to mention, and I don't know very much about this, but it's something I came across in research and talking with some people, is that another big prevention solution is, interestingly enough, architecture of hospitals. So how you construct hospitals to better protect the healthcare workers inside of them, and also then the patients as well. So that's another element that we can use, and that's often not used very much in thinking about solutions. So thank you so much.
That's a great point. Thanks, Dr. Falkenbach. And it has me thinking about work I did earlier in my career in social care, where we had a lot of training around, so in a social care settings, when we're dealing with clients that might have some challenging behaviors for us, the design of the room has always been very important. And so that shaped, I mean, I was working in family violence, so that was clearly high on the topic. But when it comes to healthcare, we hadn't had to think about this before. It wasn't on the agenda. So thank you for raising the design of spaces. Dr. Kuhlmann.
Just thank you very much. Just to add to this, I agree with all what you said, and think it's a very important process to think of these details. At the same time, there are some common issues for all healthcare workers that experience violence. And I think that is lack of protection, lack of prevention, lack of respect, public respect. And that is therefore also a civil society issue and an issue of policy. So, and therefore I believe it's important to think of these different levels to act as I totally agree. Only thinking at high level does not really help, because we must think of implementation. But at the same time, raising this awareness is a key issue. And I think that is something that is currently still missing, except our now starting initiatives or so. But there is I heard very rarely, if ever, from health policymakers who really make that a key point. So, and that's something which I think all healthcare workers feel and suffer from, that there is not enough attention and not enough respect also from civil society for their work. Thank you.
Thanks, Dr. Kuhlmann. What I'll do now is, we still have about 10 minutes before we finish, and I'm going to reflect on some of the comments that people had shared in their registrations. So I'm just going to call out a couple of things, and as you've already noticed, I'm juggling a lot of screens, so bear with my clunkiness as I do this, and feel free to jump into the panelists at any time. So I'm going to randomly look at things. A sour healthcare worker to patient relationship jeopardizes both the patient's outcome and the performance of the practitioner. So people here are making lots of comments on the power dynamics that exist, and it looks like they're trying to link it to some other issues. And a lot of people are talking about think of it as a societal issue. So, and I believe maybe Dr. Falkenbach, you'd already pointed to that, to think about it within context. And Dr. Kuhlmann, I can see you responded to that one question about other people who have an interest in addressing this topic. Does anyone have an additional comment about how does this sit within the broader societal power issues and the broader societal problems? Like, is there a way that we could more strategically link our response to other things happening more broadly? Do you think that we've positioned ourselves well enough today, or do we need to think a bit differently about how other violence is being addressed culturally?
I could just jump in saying that obviously violence, as I was saying this at the beginning, is just unacceptable. So we need to work from the school for children. We need to work at the university, making this clear. We need to make it, to speak loudly and raise our voice against that. We need to also to speak with politicians, because this is a political problem, and actually this need to be really tackled, because actually we need to make it clear that we shouldn't shoot the piano players. We are doing our job in the best possible way. Sometimes I know that people are not tolerating the frustration, but they should channel this negativity or this problem in other ways. And this is absolutely unacceptable. They should know that this society as a whole is going to react defending health professionals, at the same time defending common sense and respect. As Ellen was saying before, respect is basic in both directions. We also have to ensure the proper respect, but this is the basic way of surviving in our society. Otherwise we are going to go to a wild kind of context that is absolutely not the one that we would like to be.
Thanks, Professor Martin Moreno. I have another question that I might point to Dr. Zapata and to Dr. Falkenbach about. And so this question is, Tomas, did you want to?
Yes, Tomas.
Yes, I wanted to kind of, after the intervention of Jose Maria, I would like to mention that one key component in my point of view is politicians, because, they are so on the media, they are so powerful in the statements they make. And now that we have so many strikes in many countries in the region, I think it's really important to work with politicians so that they convey a message that is respectful for health workers. Because what we see in many cases is that when a politician openly criticize health workers in the media, at the end of the day is really putting oil or putting gasoline in order for fueling future violence against health workers. So I think it's really important that politicians are fully aware of the responsibility as public people with a lot of media attention, so that they really put in value health workers. I think it was done during the COVID pandemic. So I think we should continue in that line of really putting in value health workers and not really bringing them down in front of everyone, because that justifies later on behaviors of violence against health workers. Over.
Thank you, Dr. Zapata. And actually, a lot of people made comments about that in their registrations, mentioning the press and misinformation. Professor Jose Martin, did you want to add something more? If you want to unmute your microphone.
Yes, just quickly to add what Tomas was saying, that it is obvious. We need to tackle politicians. We need to tackle parliament members, because actually this is a question of proactivity and legislation and making it clear the ground rules of this relationship. But I think that we should also take advantage of the momentum of the pandemic. The pandemic has been a big problem, but at the same time has brought some kind of sensitivity and at the same time admiration by many people through healthcare professionals. So one thing that we should go also for it is to get the support from influencers, from key figures, not only politicians, those who really were acknowledging the work of health professionals at the difficult moments, that will also have an influence in the society, making it clear that the violence is not going to be ever a solution, that they should try to, think in different alternatives to put in an assertive way, the problems if they have, and their feelings, which could be perfectly legitimate, but never channeling through violence. And probably this kind of figures, singers, actors, influencers could help us also in this endeavor. Thank you.
Thank you. So in the interest of time, we've still got a bit of time left, about 10 minutes left. So what I'm going to do is there's another question in the Q&A that I'll come to, and I'll reach out to some of the other comments that people put in the registration. So thinking of the one in the registration, so a lot of people talked about what is the definition of violence. They're thinking about physical violence as well as threats and unkind ways of speaking. So one of that is addressing the different types of violence and making sure that the full range of violence is understood. Another comment was saying that in someone's region, they said they noticed a sharp increase in incidents of violence after COVID. And I'm wondering to the panelists, is that something that you're seeing as well? So why now is this work getting a particular kind of attention? Is there a relationship to what's changed because of COVID? Has anyone observed anything like that or have any reflections? Could I, maybe if I could start with Dr. Falkenbach, because you, to put you on the spot with this one, I mean, you had said there's a need for more information, like we're lacking in a lot of insight, but from your perspective, have you seen anything pointing in that way?
So thanks, George. I think one of the main reasons, and this is perhaps not a reason to directly look at violence, but violence, especially during the COVID-19 pandemic, where health and care workers already face this really great risk to their own health, made these workers even more vulnerable and subjected them to greater abuse. And that in turn propelled physical and mental challenges among this proportion of the workforce even further. And the problem is that in a time when health and care workers shortages have already reached all-time highs, violence against this group of people is yet another reason as to why people are leaving this profession or not even entering it. And in a time when countries across the globe are kind of struggling with healthcare worker retention and recruitment, protecting this core group is quite essential. And I think that this problem with retention and recruitment has perhaps also opened policymakers and civil societies and everybody's eyes kind of a little bit as to what are some of the challenges that are propelling this problem that we're seeing with people not wanting to enter the profession, people that are leaving the profession, people that don't even want to, go in that direction anymore. And perhaps that is one of the reasons maybe that is attracting more attention to this type of research.
Thank you, Dr. Falkenbach. Dr. Zapata.
Yeah, I wanted to raise that I think one of the causes here, I think, is that what we have seen after the COVID pandemic is really a significant increase on the demand for services. So even if we have health workers, but the demand has increased so much, there is a big gap between what the health system is able to offer to provide services and the demand. So and that creates a lot of frustration, which in no way, as Professor Jose Maria Martin Moreno was mentioning, should be channeled through violence, but in many cases, I think it's generated a lot of frustration and a lot of anger in patients that are, and they channel it through violence. So I think this also should be an argument to really invest in the health systems and invest in addressing the backlogs generated after the COVID pandemic and addressing an aging population, investing more so that we can really try to reduce that gap between demand and health workers, because currently that gap is increasing and it's generating a lot of frustration on the patient side, but also on the health workers side. And that's why we have strikes all over Europe.
Great, thank you very much. Okay, so let's start to wind up the discussion. There's two comments left that I'll just address. So one of them is from Marina Losevic, and she says, the one important aspect of violence is public defamation and wrongful litigation. So a point to some of the legal aspects, and certainly those were also raised in some of the other registrations. So that's obviously something for us to also keep in mind. And so thank you for mentioning that, Marina. And then maybe as a closing question, and I'll use this question to say, let's do a small round of any final comments. So Lorena Bianca Sandu says, what important elements do you each think that a campaign could have in order to influence the mindset of the general population and raise awareness over the healthcare workers and the hard job that they do, such as the adversities that they may encounter, such as work violence and tiredness. So essentially we'll reframe that question as a sort of final comments of what are our next steps, and any other final comments. So can I start with, I might go Sarada, then Professor Martin Moreno, then Dr. Zapata, then Dr. Falkenbach, and then Dr. Kuhlmann. So Ms. Das.
Thank you very much. No, maybe just as a sort of closing remark, no, I agree very much with what was said, that this pandemic has created not just pressures on health systems, but obviously on patients, on patient care. And some patients are now receiving aggravated diagnosis just due to the lack of access to care for much time. So this is something to be taken into account. And we can only just repeat a message that I've been repeating in many recent events, is that we see very little action on actually addressing the underlying problems in healthcare systems by governments. We see continued underinvestment, and we fear that this will lead to an even more escalated crisis than we are already in. So this really requires attention, and all of these problems, everything is connected, and requires really coherent work by health policy makers, by financial policy makers, by educational policy. And yeah, we can only put our contribution into raising awareness for this interconnectedness.
Thanks, Ms. Das. Professor Martin Moreno, any final comments?
Thank you, George. Yes, first of all, when we were saying before that violence is not only about physical violence, it's about psychological and emotional force. Anything intended to hurt and damage someone is violence. And here, I think that it has been said that legislation is, of course, key, making it clear that at the end, whoever chooses to exercise violence against health workers will be very heavy cost to them. That should be very crystal clear. And at the same time, I would like not to dismiss the importance of social education and professional education, because this is also essential to tackle this issue. Thank you.
Thank you. Dr. Zapata.
From WHO perspective, I would like to say that it's zero tolerance against violence against health workers. This is a red line. This is a no-go. And as WHO, we are fully committed to really say this loud and very high at the political level, with the Bucharest Declaration, with the regional committee resolution. So we are really be very clear on this, so that the message can be heard and can be really implemented. Thank you.
Thank you for that, for emphasizing that very important point. Dr. Falkenbach.
Yes, from the observatory standpoint, we support the increase in research, absolutely, the increase in knowledge brokering on this issue, the need for more data and general emphasis on the topic. But also I want to touch on something that Ms. Das said, and that is the intersectionality, and that we need to be working together across the different sectors, working health with education, health with the finance minister, and only with this big intersectoral nature will we be able to address these problems, these systemic problems within the health system, and really move forward. Thank you so much.
Thank you, Dr. Falkenbach. And actually, my final comment before I hand over to Dr. Kuhlmann is to build on what you've just said, which is health management takes place at all of those levels. That intersection is also where health management takes place. And although we've heard that it has social elements that need to be addressed and political elements, it doesn't change that at a management level. So at the operations level, we still need to see lots of different management practices put into place. We need to make sure, adding to what Professor Martin Moreno said, of the education is being given to people to have the skills to do this successfully and in better ways. And lots of comments about better data capture, all of that is also management practice. So there's a lot more to do operationally. And we can do that, but it still connects to other things. So unless the other things are addressed, the broader social political aspects, we're just going to be putting band-aids over leaky pipes. So we need to see action everywhere, including in operations management. Dr. Kuhlmann.
Thank you very much to George, everybody. I could not agree more with you. So there's little I could add to that, but more on a practical note. I think we heard from Thomas as some outcome also that there will be a declaration. So first thing, we can all help to announce this declaration. And the other thing is, I really think we should set up a meeting and think, how can we find money to organize this kind of campaign? It must be a real campaign, not only research. Research is one issue, but there's all the things, like you do campaigns, you need the media, you need a program, a strategy behind that. And that means to really push this issue on the different levels with the different tools that we have. And I think that's something which needs some money, and hopefully, especially if we support, or no, that we support, that is clear anyway. If we help to highlight this WHO declaration and other issues, maybe then there is a chance that policymakers listen to us, and we can do a little bit more, because that's from my point. So as I said, in practical terms, otherwise everything has already been said, and I can only repeat that I'm extremely grateful for the opportunity to make this first step, and look very much forward to continue with you this very important work. Thank you.
Thanks very much, Dr. Kuhlmann. I'll just show you one last slide before we finish, as a way just to say thanks to everybody. Dr. Kuhlmann, you make the good point that all of this work came together from people just adding this to their existing workloads. We haven't yet got dedicated resources to take this work forward. And so the way that that's all been done by everybody here is very generous. Everyone's attendance today and you feeding into this work is great. We want to take this work further at the EMA conference. EMA has a vision of excellence in health management for a healthy Europe. We want to do that by having these discussions with people. On the next slide is what I meant to show you, to say, so the EMA conference is 5, 6, 7th of June. We're going to have a workshop, I think on the 6th, but we're just going to lock that in soon, to talk about exactly this webinar, taking it further and actually workshopping some actions with people involved in health management from many of those perspectives. So if you can be there for that, stay tuned, or watch that space for the reports that come out of it. And otherwise, I want to thank you all again for being here today. It's been really fantastic to have this discussion. I'm really glad we're doing this work together. Thanks, everybody. Thanks all the panelists. Thanks the attendees.
Thank
Bye,
you.
everyone.
Thank you.
Thank you very much.